Blessings. This is Johanna Rodriguez from Bilingual Christian Academy and Technology and BCAT Sports. And I want to welcome you and thank you for being here with us again in one more amazing program of BCAT Buzz. And here with me, as always, is our athletic director, Coach Abimelech Torres.
Nice to be here again. And I'm definitely excited for this opportunity to get to meet our doctor over here a little bit more into detail. So.
Right, and also Coach Giovanni Rivera, which is our assistant athletic director.
Good evening. Thank you.
And today our special, I'm just like that, just very short.
Very short.
Yeah.
Short and precise. Short and precise.
Today he's not going to talk that much today.
No mistakes.
No mistakes. Well, and I can't wait to present to you our visitor today, which is amazing to have him because he's going to be answering so many questions that probably you have. And it's Dr. George Richard. Doctor, how are you today?
Good, and it's a honor to be here.
No, it's our honor to have you, right, guys?
Yeah, definitely.
Dr. Richards is an orthopedic, right?
Correct, orthopedic surgeon, yep.
Only that. And sport medicine. So we are blessed to have him. And he took from his busy time, believe me, from his busy time to come here and answer some questions that we know are going to be very helpful, not only for our student athletes and our coaches, but for you that probably you're attending another school or you're doing any other sports with another coach, this information will help you in whatever sport you're practicing, okay? So stay tuned with us. So Dr. Richard, right now you're working with Rothman Orthopedics, right?
Yep, that is correct. I'm an orthopedic sports medicine physician. I work for Rothman. My two offices currently are in Lake Nona. I do also work out of Orlando and Davenport and Polk County.
And if you're wondering how I got to meet Dr. Richard, well, he was the one that treated my son, Ryan. If you know Ryan, the nightmare, remember? So Ryan was treated by Dr. Richard, and I had the privilege of having a long conversation with him. I don't know if the other patients like me that much after that time because...
Everyone knows they've got plenty of time.
Okay, that's good. That's good. But Dr. Richard, I know that you were born and raised here in Florida, right?
Correct.
And where did you study here?
So I originally grew up in Gainesville, grew up a huge Gator fan, and ended up going to college there, luckily, just by the skin of my teeth. Ended up taking a couple years off and eventually going to med school in Tampa. So after med school, went back to Gainesville for residency. And the first time I left the state was for fellowship in Birmingham, Alabama. And then with my wife and I both being from North Florida, Central Florida, we decided to move back to Orlando. Our parents are here. We've got 2 toddlers. We need a lot of help.
Yes. They know. He knows.
Definitely. Got 2 of my own as well. So definitely.
Wow. And you were an athlete yourself, right? When we were talking, you mentioned something about that.
Correct. Yeah, I grew up playing multiple sports. And I think that's something we can talk about later. But played multiple sports. I think I played football, basketball, soccer, track and field. So everything was just fun for me, especially in high school. I think if you had to pin down what my favorite sport was, it was probably football.
Wow.
I played defensive back and was also a running back for a period of time. But that's really where I kind of found my passion for sports.
So your knees hurt a lot at that time, huh?
Shoulders.
Shoulders.
Concussion's what took me out.
Yeah.
Oh, yeah, that's why Ryan ended up in your office.
Yeah. For us, it's the knee, right? That's Coach Rivera.
Yeah.
Little bit.
One of the first questions Coach Rivera has for you, what was it?
So, is it age or is it previous injuries that when I'm sitting down here for like half an hour and when I get up, my knees crack? Do I gotta get therapy or is it just gonna happen?
I think he's just old.
For you, it's just because you're old.
I knew it. We didn't have.
I think he was hoping that you were gonna give him another answer.
I told you we didn't need a doctor for it, man. I told him. They didn't want to believe me, doc.
The bottom line, it's kind of a chicken or the egg thing. I mean, what came first? A lot of people will sustain injuries in their young athletic careers. There definitely is a contributing factor for degenerative disease later in life if you do sustain injuries with certain joints, but it's not always the case. I think there's a myth out there that if you jog a lot throughout life, that you're just going to develop arthritis later.
Yeah.
I think that that's not true at all. There's a big genetic component to degenerative change later in life that we're still trying to understand arthritis in general. But I think the benefits of living a young, healthy, athletic life where you're active, you're not just sitting on the couch all day, greatly outweighs the potential long-term degenerative effects.
You were pretty active when you were young, so I think it's definitely the injuries. So definitely the injuries and
Out
age.
of concrete
basketball
outside.
Exactly.
It's true. In Puerto Rico, basketball is played in concrete. It's not like here, that you have that cushion that helps the knees and all that. So
Definitely.
I bet you see a lot of Puerto Ricans in your office, but yeah, we were one of those. Now, let me ask you, doctor, when we talk about basketball, what are the most common injuries you see in your practice due to basketball?
The most common injuries are those that if you give them enough time and rest, they will get better on their own. So, in that respect, we're talking about common tendinitises, overuse injuries in the young athlete, simple sprains like ankle sprains or, knee injuries that really, if you got an MRI, you wouldn't see anything wrong. And then taking the next step, less common, but still, I wouldn't call them rare injuries, would be, true injuries like a ligament tear. The most common thing in basketball that you think of with that would be an anterior cruciate ligament injury, something that would need surgery typically, or a meniscus tear. And then for certain individuals that are prone to it, you can see patella dislocations. But, by and large, the most common thing we see in the office is going to be jumper's knee in the young, skeletally immature athlete, shin splints, patellar tendonitis in the older, more skeletally mature athlete, things like that.
And usually that is because they are overworking themselves out, correct?
It's a mix. I think that if you were to pin me down and say one answer $1 million question, I'd say overuse.
Okay.
But it's more nuanced than that. I think nowadays more than ever, young athletes are pressured into sports specialization. And sports specialization, and I referenced this earlier, kind of when you gave me the opportunity to introduce myself, but sports specialization was not a thing when I was in high school.
Definitely.
And it doesn't feel that long ago for me, but when I think about graduating in 2007, it was a long time ago. But when you deal with sports specialization, athletes are doing the same repetitive motions over and over again. In basketball, it's a lot of jumping.
Yeah.
And it makes you more susceptible to certain overuse injuries.
Yeah.
In baseball, it's medial elbow. You think about apophysitis of the medial elbow, which is just kind of inflammation of the growth plate. It's because it's a repetitive injury. So in baseball, the MLB has introduced Pitch Smart, which is an awesome tool that leagues and parents and coaches can use to make sure that we're optimizing kids' healing rate and preventing them from these overuse injuries. We don't really have that in a lot of other sports. No. And the reason for that is that in baseball, it's become an epidemic.
Yeah. I believe in basketball, for example, like kids are so into playing nowadays and not really resting or practicing in that matter that I think, even us, we see it every time. When we say we want to take a break, for example, of playing, the kids, for some reason, they don't want to stop and they look for another team and continue playing. So I definitely see the correlation there as well. But my question to you, how much is a lot of work in your opinion?
That's a good question because it's hard to tell them or explain to them you're doing way too much.
I think the best way to answer that is to correlate what we know from baseball, which is the best studied sport in this case. And the key is to take at least 3 months off a year from your particular sport.
Oh, wow.
So avoiding sports specialization is kind of the key. In baseball, we tell them avoid throwing for 3 months, essentially, especially when they're young and skeletally immature. In basketball, maybe it's as simple as, hey, play another sport.
Yeah.
When it's basketball season, it's basketball season. When it's, let's just arbitrarily say they do track. When it's track season, it's track season. And that helps the young athlete not only avoid overuse injuries, but also diversifies their talent a little bit. It gives them exposure to another sport, gives them the opportunity to make friends outside of their primary sport friend group.
I've heard that, multiple, big name athletes like LeBron, like, AI, for example, in our time, like they were multi-sports athletes. And eventually, when they specialize in one, they ended up being very dominant in that sport because they had all the information basically in their brain, So I believe that definitely is very, very key.
When you can pick up different skill sets with different sports, soccer, football is very much a footwork sport. And in basketball, I think footwork is often, understated. It's a huge part of the game.
Yeah.
Let's throw out boxing.
Mm-hmm.
That's a dance. It's a football. That's a footwork sport, as much as it is upper body and landing blows. So, I think that there's a lot of carryover. And if you look at the the college football playoff teams from the early 2020s, and you look at those athletes, I think the statistic is, don't quote me on this exactly, but it's around 80% of athletes played at least 3 sports in high school. I think the mean was like 3.4 sports. So the goal here is to just get kids to play multiple sports.
Yeah.
And that resting time, because when I heard you said 3 months, about 3 months for that athlete not to do any specialization in a specific sport. Coaches usually think that if they give the athlete that length of time, they're going to be losing skills or they're going to be losing, opportunities. So this is something that needs to be taught not only to the athlete, but to the coaches and to the parents as well.
But I think when, doctor emphasized play another sport, we're not actually like completely laying off from, playing sports or doing physical activity. That's a big difference, I believe, because if we're going to take off, it's not completely off, you know what I mean? So in a way, our kids, and I can put our kids into perspective, because when we say, okay, we're not going to play for, let's say, a 4-week period, for some reason they get so anxious about like, I'm gonna get, rusty, for example. I'm not going to be, playing well. And I think it's quite the opposite. When you take that time off, even look at Doncic, for example. He went into a weight management, training this summer, didn't touch a ball for like weeks. He's not going to forget how to play basketball. I mean, come on. So I think these kids nowadays have poor information in that regard, I believe. And
I don't know for sure if that 3 months is translatable. That is very much a baseball thing. And if if I look back on my time in high school and I really didn't ever have an overuse injury, it wasn't that I was totally avoiding that sport for a full 3 months. I mean, sometimes I get home from school and kids in the neighborhood were playing basketball.
Yeah.
Well, guess what? I was playing some basketball, but it wasn't an everyday thing.
Yeah.
If it was football season, and I was in the middle of football season, I would still play some basketball.
Yeah.
Go out there, maybe once every 2 weeks. Maybe I'd go out and practice my form, work on free throws.
Yeah.
The key is to just, it shouldn't be a daily thing. It shouldn't be a year-round practice thing. It shouldn't be, hey, trainers on the side working with you when you're, still in the off season.
Yeah.
What would be a healthy routine for a basketball player? For example, I can use my own son. That you spoke to him about it anyways, but he used to do legs, for example, in the morning, 5 o'clock in the morning, wake up, do some running, do legs, whatever. Then he will go to training for three hours with them. He will be exhausted because let me tell you, they kill him.
We're working.
If you belong to Big Cat Sports, you know what we're talking about. They mean business when you're there. And then once he got out, he will go take a shower and go again and train at a gym and do legs again or something like that. What can you advise these players that think that it's a matter of doing a lot?
I think So when you look at the professional landscape, even those players are not doing that sort of regimen. Primarily, weight training, strength gains, speed gains are all things that will occur in the off season when you're not under significant intraseasonal, physical strain, or you're not having daily practices where you're really kind of putting in high intensity work on the field. So a large portion of what I tell athletes is the off season is when you make those gains. And if you're having high intensity training sessions in the off season, you shouldn't be doing workouts on the same day as you're doing these high intensity sessions, because that's going to set you up for fatigue while you're playing, which will increase the risk of injury.
Okay.
There is a really well-cited study in the baseball world talking about how fatigue increases risk of UCL injury by 36-fold. So you're talking about big numbers, and that is probably translatable to a lot of other sports.
Definitely.
So
you had published, I was searching around, and you had published some research you've done on baseball. Why did you choose baseball?
Baseball pathology I find to be really interesting. I like taking care of overhead athletes. The shoulder and the elbow are really fascinating joints. The amount of strain that each of those joints go through with a pitch is at its maximum load for the ligaments every single time they throw the ball. And so I think that the human body can do that and throw a ball 100 miles per hour is wild.
Yeah, it's fascinating. It's fascinating.
Yes.
80 times a game.
Yes.
The starters are throwing a lot of pitches. I just think that is fascinating. Equally fascinating as I think that people who don't play those sports have figured out a way to get those pitchers back on the mound after they blow the ligament. So that was, that happened way back in the, I believe it was the 70s with Dr. Job and Tommy John. So that's why the surgery was named after him.
named after him.
So just the history is also fascinating. So that's why I have a long, early in my career, I've studied and published a lot on baseball.
Yeah, and by the way, he got several awards because of it. I know. I know. I've been researching.
You didn't hear from me.
He's humble, but believe me, I wish we could have a whole day of conversations with Dr. Richards. But believe me, the amount of information I gathered that day in that conversation, and right here, right now, everything he's been discussing are things that we really want to find a person as parents and even coaches that could guide you in these directions. Not always you have somebody accessible with your knowledge to take the time and give us some education in certain things that we do on a daily basis.
And not only that medicine changes on a daily basis. So, maybe information that we had, 5 years ago, the way we training basketball players 5 years ago, maybe that's not, maybe you guys found out that was not the correct way and we got to change that. So I believe that this is a great opportunity, not just for us as a program, but for everybody else that's going to watch this episode, that realize that this is a continuation in an every single day basis. So we have to take advantage of this opportunity that you present to us. So that's amazing. Thank you.
You're spot on. I think that the saying goes in medical schools, 50% of the information you learn in medical school is wrong.
Yeah.
And the other 50% we find out to be wrong later.
Yeah. They're continuously learning. So that's good. And, this, again, the problem with this, the kids nowadays, that they're getting blown out with all information. And sometimes that information out there is not really the correct information. And phones as well. Like we were talking about this earlier before we started the program, how connected are the kids nowadays, with their phone. And it's funny because in the church that we go, the pastor says the electric organ that we have. And everybody kept looking at each other, the electric organ. What he's talking about, the phone. Like, people cannot live without the phone anymore, and kids even. Kids are on that level right now, and they're getting bombarded with information that not necessarily is correct.
You're 100% right. I think TikTok is one of the apps a lot of kids are using And I don't have that exact app, but even on Instagram, when you scroll, you'll see people talking about different medical conditions, and you never really know their background or their training. And unfortunately, I think our kids are now put in a position where they hear a lot of information.
Yeah.
And they're at a point in their life where they don't have the education yet to teach them how to vet that information to make sure it's accurate.
And I see it every day. I see our athletes, they do stretches that, 7 years ago, I was taught to never do that because it hurts my knee joint, for example. And I see them doing it right now, and I ask them, like, why are you doing this, right? They say, no, I watched this video that's going to help me out because it gives me more speed, or it gives me more height in my jump, for example. And it's like we have to battle with that on a daily basis.
I believe it.
Yeah.
What would you recommend, or what would you say is the right, I don't know, could be a right set of exercises to develop a player?
For primarily injury prevention.
To prevent injuries.
I think so. The only evidence-based routine that we really have is something called FIFA 11.
I think you guys are going to see it on the screen.
A research group associated with FIFA came up with this, and it's really well studied and vetted for football/soccer, and it has been shown to prevent injuries in randomized control trials. So that's the highest level of evidence. So, when physicians try to talk to patients, we always try to be as objective as possible without letting our own biases intervene. And I will admit that that's impossible. We all have our own biases. But the goal is to at least attempt that. And when a bias does come up, you at least tell the patient, hey, this is why I feel this way. Because then that's more of a subjective opinion.
Exactly.
So I can objectively tell you that with a very high level of certainty that this program can help prevent injury, specifically in soccer. And we don't know yet if it's translatable to other sports like basketball, American football, baseball, but maybe it is. And you don't lose much by trying.
Yeah.
Is this an area that are, doctors such as you are studying on a regular basis, or this is just like a random thing?
I wouldn't say that it's a regular basis, which is unfortunate. I think that there is a big push for injury prevention because, it's very important not only to reactively treat injuries, but to proactively prevent them.
Yeah.
Medicine has historically been very reactive.
Yeah.
And more recent history, we have tried to start pushing into the proactive area of prevention, but the studies to do that are much more challenging, sometimes take more funding, sometimes they 100% take cooperation from other individuals, which adds to the challenge. Like if you wanted to study the effect of this FIFA 11 program in our region of Orlando, let's say that you chose the sport of American football, just ballpark, you would have to get athletic trainers and coaches on board to having their athletes do this before every training session. And the only way the research would be viable is if they followed through with their commitment to do it. Because if they start skipping, then the research may not.
Then it doesn't give you the correct
may
results.
not be accurate.
Yeah. Okay.
Yeah.
Makes a lot of sense.
Even if it shows a positive result, it may not be, accurate just because we didn't follow through with what. And it's not hard. I mean, it's not easy to do this. I mean, I think once you get proficient at it, it can be done in about 10 to 15 minutes.
Yeah.
But what does that cut into that the coach wants to do with the team? So you really have to get a lot of people on board to do research like this.
Yeah.
Even with Pitch Smart, which is something I brought up earlier, it applies to baseball, but it was very challenging to get teams and coaches 100% on board on this. And even in some leagues, they don't follow it. Still to this day, even though we know that they prevent injury, they still don't follow it.
Wow. Now, is it a myth or a reality? What people say that for example, a 13-year-old lifting weights, will that affect their growth?
Likely not. I think that a lot of that myth comes from what we know with high impact on certain joints. You can see repetitive impact on certain joints can cause physeal injury. You can see that sometimes in gymnasts when they do a lot of platform maneuvers on their wrists. You can see it. But by and large, a safe weightlifting routine is going to be fine for a large number of individuals, especially if you're talking about a young teenager who is, early puberty or hitting puberty. You really shouldn't have much concern. Should they be going to the gym and, trying to max out lifts every day? Absolutely not. But, getting them into the routine of a healthy life, lifting weights, building good form, not trying to, ego lift is what I call it when you go to the gym.
You hit on the right point. Ego lift.
And the parents, we mentioned this because the parents as well are misinformed too. So, and most of the times they're reacting or going by what they heard maybe when they were young, and maybe that's not the case right now. So we go back to information, and we definitely, me and coach as well, we always tell parents it's not that you don't lift. It's obviously, like you have mentioned, that we're not asking you to lift 500 pounds. If you can't lift something for 10 reps, you shouldn't be lifting it, for example. So, I believe that for our parents that are watching this, this is a great opportunity for you guys to watch this and say, Mr. Torres and Mr. Rivera are not crazy because they're doing weightlifting to our guys. So I think we have to get educated a little bit more. I think we have to have people like such as yourself, to pretty much have some time and educate the masses as well. So,
and I think it's really important for parents to realize that when oftentimes coaches get kids into weightlifting, they're doing it maybe twice, 3 times a week. They're not going to be training like college athletes or professional athletes, even, because I think that that would be inappropriate.
Yeah,
but, I mean that's obvious.
Yeah, and then we'll probably fall into that specialization again that you were mentioning.
Exactly
that
right.
If you start lifting every single day, then you're not really a weightlifter.
Exactly.
You know what I mean? So we go back to that. Do not specialize. Have a little fun. In other words, have a little fun, guys, please.
Yes, be flexible.
I usually tell my patients, when I hear about sports specialization, I always bring up, if Lionel Messi had started playing soccer at 18, number one, he probably still would have made it professionally.
Yeah.
He would probably still be one of the best ever. And that goes for Michael Jordan. That goes for, any really good professional athlete. If you got it, you got it.
Exactly.
Protect the tool until there's some sort of investment in you as an athlete. When you're getting paid as a professional athlete, those guys make sacrifices, but it's different.
Yeah.
You're getting paid. It's your job.
Exactly. Correct. And our legs, in basketball, I read this from the Mamba book from Kobe.
Yeah.
Your legs have an expiration date. They have a certain amount of hours that you can put that strain into. So if you start, the younger you start, the less time you're gonna have eventually in your career. Pretty much is over. Like, people don't realize. And we spoke about this with our kids. If you put into perspective, for example, LeBron's career, this long career, you don't really see that very often.
Yeah.
And I know our control guy over there probably is he's a Jordan, Jordan is my GOAT kind of guy. But I'm talking about only the career. You never see a long career like that. So, so for the kids to start very early as well and working every day and specializing every day on a specific sport, you're taking away that precious time that eventually you're going to need.
Yeah. You got to protect the tools.
Yeah.
True. Now, how did you end up being a doctor or a surgeon, orthopedic surgeon? What made you think on this profession after playing all those sports?
It's slowly evolved. I think having the background of sports, I didn't really ever lose that passion. So I continue to watch sports. I'm a huge Gator fan, so I watch Gator football, basketball. I watch professional sports.
You're happy this year, right?
I'm so happy.
Yeah, for those that didn't know, NCAA March Madness, the Gators won it this year. So
Absolutely.
I'm happy doctor.
Yeah. But as that passion carried forward, I went into medical school to become a physician for very different reasons. My dad was a physician, so he lived a very busy life. And growing up as a young kid, a lot of the time I got to spend with him was if I got to go to work with him. So I got to see his job. I got to see the satisfaction that he got from helping people, and the joy of being a physician. And that really was motivating to me to pursue the field once I got into college. Once in medical school, you start to see different paths you can take. And one of the key questions you ask yourself is, all right, internal medicine or surgery life? And for me, I liked procedures. I was always handy around the house, went the surgery path. And then once I got into that road, it was orthopedic surgery, because that was the pathway that I could kind of merge two very big passions of my life into one.
Yeah.
So now I get to see sports injuries. I get to talk to young athletes like your son, and I got to spend time with them. I get to see them get back to their sports. And I get to even do research on it, like we discussed. Yeah. So, it really, for me, was kind of the best of all worlds combining. And that's kind of how I got into it.
Amazing. If you were to mention some of the career pathways that are out there for young athletes, because right now we have some of them are about to graduate. They don't know what they want to do. They do know they're passionate about sports, and they can only think on getting a scholarship, a D1 or D2 scholarship, and they cannot see further.
Yeah.
Can you mention some of those areas that you've seen?
Have Plan B.
Exactly. Yes.
Plan B, Plan A can be number one and should always be number one. For the longest time, I was going to be an NBA basketball player. I stopped growing. Quickly realized that was never going to happen. Even if I did grow, I probably still don't have the athleticism to do that. But regardless, that was Plan A for me. And I think my parents would laughingly tell you about the days where I was dribbling the basketball in the house all the time. But Plan B is important, and they always talk to me about that as well, because your world can't end if Plan A doesn't work out.
Exactly.
And there are a number of options where, if you're passionate about sports, you can still have a very fulfilling career. I'll start off with healthcare. So you can go into medicine, and you don't have to go into surgery to take care of athletes. You can go into non-operative medicine and still specialize in sports med, take care of athletes. You just won't be doing surgeries. You can still cover teams if you do non-operative sports medicine. Very important role on a lot of professional collegiate organizations. You can go into surgery, which is what I did. You can go into athletic training, which means that you are preventing injuries. You're managing sprains. You're managing the athlete's career and trying to determine if they need to see the doctor. You kind of are on a team with the physician and the physical therapists managing the athlete's career. So that's a really cool path to go to. Professional teams have athletic trainers. College teams have athletic trainers. High schools have athletic trainers. And I work really closely with the athletic trainers. If you ran into any of them, they'd all have my cell phone number, because they've got to reach out and contact me if their kid has an injury and they need to reach out. Physical therapy is another cool role that you can get into. Teams have physical therapists now. Yeah. And there are a lot of different pathways that you can go within physical therapy. If you wanted to go into something other than healthcare, you could think about player representation, whether that is being the marketing aspect of that or going to law school and becoming an agent. You could, there are so many other routes that you can go into that involve sports. You can go into social media with sports, broadcasting. A lot of athletes go that road. Even, talking about publications. What about writing articles, doing newspapers? Now they're all online, but people still read that information.
Yes.
They still get that information.
Yes, true. We lost Coach Gio when you told him that his problem with his knees was about his age and everything. We lost him. He was like, you know what? I'm not going to be part of it anymore.
I'm still thinking about it.
Honesty is the best policy.
He still got hope. He still got hope.
And before we go, I want to ask you, how important are the warm-ups before starting to play?
Warm-ups are critical, even before the FIFA 11 program. If you're interested in doing that, if you read the pamphlet, and there's a whole online PDF about it, they go into detail about how warming up before FIFA 11 is crucial. And then when you're doing FIFA 11, you have to have the right mechanics. So they show you on the full PDF alignment of the knee, balance, and everything, that you have to do the things correctly. Otherwise,
Exactly.
you're building bad habits.
Exactly, which is important, and that's another problem that we have with our athletes. They know, they hear about an exercise, they try to do it without having the right mechanics, and we end up.
Proper form, we talk about
Yep.
proper form every single time. So, and they still sometimes don't do it the right way. But we try as much as possible to teach proper form.
We would love to have you with us again, Doctor, and probably even in one of our practices, so you
Yeah.
get to share
Yeah.
with the kids, and most likely they have plenty of questions for you.
You got plenty of time.
They will probably say, please, Doc, tell him that the 17s are not good for us anymore and all that. And suicides.
Yeah,
and
no suicides.
No suicides.
They really
I'm a
dislike
player advocate.
Yes. No, but definitely thank you. In our part, obviously, thank you so much for spending some time with us and actually having this time to educate us. At the end of the day, that's what we striving for our players,
Yes.
so that they can have the correct information, not coming from us. Because sometimes we're like, they don't listen to parents, but then they don't really want us. They don't really want to listen to us. So I'm glad we have another member here telling them to do the right thing.
There's no prophets in their own land.
No, exactly. So go
Yeah, but-
sleep well, eat well, train correctly, have some
Warm
fun. I
up.
guess, warm up. Yeah,
That's
and
right.
so-
And if you still haven't got a D1, D2, whatever offer, don't stress out. You just heard that. I mean, there's plenty of other options. And I know that God has amazing plans for you. So don't sweat it. Just do your part. Do your part. That's important. Do your part. Make sure that academics are on point. Make sure that physically you are on point as well. And trust that God has the best interest for you. Okay? Well, Doctor, thank you for being here with
Thank you,
us.
guys.
I'm excited about this program because I know you learned something new today. I did. Even though Coach Gio was here intimidated and he didn't want to be
I'm
part of
the
the...
backup support.
He was brought to reality a way that he didn't want to.
He's waiting for a program to be over to talk a little
talk
bit
to
more
him
about the needs
private,
with
right? But Dr. George Richard, thank you so much. If you want to see an amazing sport medicine doctor, an amazing orthopedic, not because he's here, but because I experienced it myself with my son. He is in Rothman Orthopedic. We're going to be putting the information. He is with Advent Health as well. By the way, we want to thank Advent Health because they made this possible as well. They were the channel for me to communicate often with Dr. Richard. So, guys, believe that God has amazing plans for you, as Jeremiah 29:11 says. He has good plans for you. You just need to follow your path and do what you need to. Again, thank you so much for being here with us. Honestly, hope to have you again. And for you guys, have an amazing rest of your day. God bless you. And I hope to see you again in BCAT Bus in our next edition. Have a blessed day.